Morning sickness is a misnomer because you can feel nausea any time of day in pregnancy, and it can leave you feeling miserable. You're in the right place to learn all about it. Today, we're going to talk about the causes of nausea in pregnancy and tips for prevention, as well as relief from this miserable feeling. I'm Dr. Lora Shahine. I'm a double board certified OBGYN and reproductive endocrinologist, helping people with nausea through pregnancy for almost 20 years. And I am here with some tips to help you. I am so glad that you found this channel. Be sure and subscribe so you get my weekly video all about reproductive health. Another great resource for learning is my podcast. It's the Baby or Bust Fertility Podcast. Comes out every week with episodes, interviews with people in the fertility field, and solo episodes where you're learning all about reproductive health. I am here to help you learn. In today's video, we're going to learn all about a really miserable feeling that is so common, especially in early pregnancy, nausea and vomiting of early pregnancy. We're going to go over 5 main topics in this video. Number 1, we're going to go over how common it is to get nausea and vomiting in pregnancy. Topic number 2, we're going to go over causes. Topic number 3, risk factors for nausea and vomiting in pregnancy. Topic number 4, we're going to go over tips for prevention. Wouldn't it be great if you just didn't feel this way in pregnancy? And finally, topic number 5, treatment options for relief if you do get nausea in pregnancy. Now stick around to the end of this video where I go over when to worry about nausea and vomiting in pregnancy. It's common. Most of the time, people find ways to deal with it, but there can be a tipping point where it is time to really talk to your doctor and even go into the clinic or go to the hospital to really ask for help. I'm going to help you figure out when that point is. Topic number 1, how common is nausea and vomiting in pregnancy? It's something that you see in the movies, people talk about. The best resources I can find say it happens in about 50 to up to 80% of all pregnancies. So not every single person in every single pregnancy will have nausea, but if you do, it can be so common. Another thing I wanted to look at is if someone has nausea in one pregnancy, what is the risk of it happening again? And that statistic is all over the place. In some resources, I found it as low as 15% happening 2 pregnancies in a row or repeating, but as high as an 80% chance of it happening again if it's happened to you in the past. So those are some numbers, really common, but doesn't happen with every single person and does not happen with every single pregnancy. Topic number 2, what are the risk factors for nausea and vomiting in pregnancies? There's really 5 main ones. Risk factor number 1 is multiple gestations. So twins, triplets, the more pregnancy or the more placental tissue, there's a higher risk of having nausea and vomiting in pregnancy. Risk number 2 is a history of motion sickness. If you're just that person that often gets sick riding in a car or gets really easy upset stomach, roller coasters, etc., if you're really prone to motion sickness, you are more likely to get nausea and vomiting in pregnancy. Risk factor number 3, migraine headaches. So if you have a history of migraine headaches, it can often be associated with nausea. The migraines and nausea centers in the brain are pretty close to each other. They often seem to be interconnected. So if you have a history of migraine headaches, you are more likely to have nausea in pregnancy. Risk factor number 4, a family history. So if your mom talked about nausea and vomiting in pregnancy, you have sisters, aunts that talk about this, you are more likely to have the same issue. And risk factor number 5, previous nausea and vomiting in pregnancy, it's more likely to happen to you in a subsequent pregnancy. Topic number 3, what causes nausea and vomiting in pregnancy? There's 3 main theories. It's not completely known, but some people argue that it's a hormone cause. Some people say it's an evolutionary cause, like we are built this way as a way to evolve. And then the last theory is that it's a psychological issue, and some people are more prone to it. I kind of agree with some more than others. So the hormone theory is certain hormones are higher in pregnancy. The first one, of course, is the pregnancy hormone, beta-HCG. And as those levels rise in our system, we can sometimes become more nauseated. And that kind of theory is supported by the fact that people who have multiple gestations or more pregnancies, multiple placentas, they have a higher level of HCG. They're more likely to have more nausea in pregnancy. Another type of pregnancy, it's a pregnancy complication. It's not a viable pregnancy, but it's a molar pregnancy. It's a um, genetic issue in which the placental tissue is really kind of taking over and growing at a really rapid rate. And HCG levels can be really, really high early in the pregnancy. Those people can have significant nausea and vomiting of pregnancy. Another hormone that gets really elevated in pregnancy is estrogen. And some people theorize that high levels of estrogen could be the cause of nausea in pregnancy. This is supported by the fact that some people who take estrogen outside of pregnancy, say in the form of birth control pills or with hormone replacement therapy, if someone is nauseated when they're taking extra estrogen for whatever reason or another during their lifetime, then in pregnancy, they're probably going to get more likely to get more nauseated. And so these hormone factors, high beta HCG and high estrogen levels, could be causing a higher risk of nausea in pregnancy, could be the reason people are more prone to have nausea in pregnancy. Theory number 2 is an evolutionary theory. In the first trimester, the baby's organs are developing, the brain is developing, the limbs are developing, skin, bones, the gut, everything is kind of forming. And it's such a delicate time that exposure to certain toxins or medications or viruses in the first trimester can really lead to birth defects or a dysfunction in the way that the organs are created. And so some people theorize that we are more likely to be nauseated in the first trimester. It's an evolutionary thing for us to be more picky about what we're eating and ingesting so that have a lower likelihood of exposing the pregnancy and those really important organ forming weeks to things that could disrupt that function. So again, these are theories. It's just kind of interesting. The last theory I really don't love, but it says that there's a psychological component to nausea and vomiting in pregnancy, and people who have a history of mental health issues are going to be more likely to be affected or impacted by nausea and vomiting in pregnancy. This does not hold up in big studies. It's just whenever you look up what could cause nausea and vomiting in pregnancy, these are the 3 main theories: a hormonal reaction to these elevated hormones. It's an evolutionary factor that's helped us survive and thrive over however long you want to believe that we've been here. And then the last thing is it could be a psychological component. So those are the theories. Now, topic number 4, what are the tips for prevention? If you could somehow prevent even getting nausea in pregnancy, wouldn't that be absolutely amazing? So here are 5 things that could help you prevent nausea and vomiting in pregnancy. Of course, not for everyone, but this is something that is very interesting and could be helpful to you. Tip number 1 is to take a prenatal vitamin. So taking a prenatal vitamin for at least a month before you actually get pregnant has been associated with lower incidence of nausea in pregnancy. The theory is it's the vitamin B6 that can be helpful at decreasing nausea. Now, if you saw my video here on prenatal vitamins and how important they are for overall health and well-being in the pregnancy, you know that there are studies that say if you're taking a prenatal vitamin about 3 months before you conceive, there can be better pregnancy outcomes. So, of course, people can have perfectly healthy pregnancies without taking a prenatal vitamin before they're pregnant, but you certainly want to take it once you know that you're pregnant. And if you're trying and you could have this other benefit of decreasing the risk of nausea, it might be something to help you remember to take your prenatal vitamin every day. Tip number 2, avoid an empty stomach. So small, frequent meals, little bites, little snacks every 1 to 2 hours has been shown to decrease the onset of nausea. Tip number 3, avoid spicy, really fatty, really heavy foods. So another hormone that's elevated in pregnancy is progesterone, and progesterone slows down our gut, and your stomach is not going to be able to empty as quickly as it does outside of pregnancy. So if you're having heavy, spicy, fatty food that's just sitting in your stomach, that could increase your chance of having nausea. Tip number 4, one study showed increased protein in your meals can actually decrease the incidence of nausea and vomiting. I had this one GI doctor that put a little seed in my head that said, hey, have you ever noticed that people who have celiac disease or gluten intolerance have a higher incidence of nausea and vomiting in pregnancy? I've not seen studies on this, but I do think about anybody who's nauseated. Often all they want or all they can tolerate is saltine crackers and little pieces of bread. And so if someone that's all they're eating and they have a gluten intolerance, that is definitely a setup for more symptoms. Please tell me in the comments if this rings a bell for you or if anybody else has heard this. It was just this one GI doctor in my fellowship at Stanford. It was a conversation just kind of on labor and delivery. And I just have always wondered if there was really any truth to that. Just curious. But I can say there is this study that shows more protein can be helpful. And finally, tip number 5, I came across this a lot, is just trying to avoid stimulus, really loud noises, blinking lights, really active overstimulation, like a movie, really strong smells. All of these things can kind of trigger our nausea symptoms. And so one of the tips to try to avoid nausea is to really decrease kind of overstimulation. All right, topic number 5, tips for relief from nausea in pregnancy. If this is you, you're pregnant, you're feeling nauseated, I am so sorry. I know it is a miserable feeling. Be sure and talk to your doctor or your obstetric provider about options that are available to you. I'm going to go through some options that I found in the ACOG practice bulletin on nausea and pregnancy. ACOG is the American College of Obstetricians and Gynecologists. It's a wonderful resource. I'll put a link in the notes here. Really kind of goes through a lot of what we've talked about, like how common it is, prevention, and here finally are some tips for treatment if you find yourself pregnant and nauseated. Tip number 1, think about switching out your prenatal vitamin. Most prenatal vitamins have iron and a lot of nutrients in them that you might not need until the second or third trimester. In the first trimester, the iron is not as crucial and it could be causing more GI upset. Something that is important to take in the first trimester is folic acid to decrease the risk of neural tube defects. So be sure and go over what you're taking and what you plan to do if you're going to change it. Make sure you talk to your doctor. Tip number 2, ginger. Ginger has been shown to decrease nausea in pregnancy. One study showed that taking caplets, 250 milligrams up to 4 times a day, really helped people with nausea in pregnancy. You can get it in a lot of different forms. Try different things that are right for you. There's candies, there's chews, there's suckers or lollipops. And so I hope if ginger is the right thing for you, I really hope it helps. Okay, tip number 3, acupuncture or acupressure. There is actually a specific pressure point for nausea. And if you can find that point and massage it throughout the day, it can actually decrease nausea for some people. Of course, not everyone. This point is called P6 pressure point or Nijen's point. I have a picture here, but let me show you on myself. So you basically put 3 fingers right underneath. The top finger should be at the crease of where your wrist is. 3 fingers right here. And then take your thumb right under where that third finger was. You find those 2 tendons that are right there in your wrist, and then press right in between those 2 tendons. You can kind of go in a clockwise fashion or a counterclockwise fashion. Do it for 30 seconds, do it for a minute, whatever feels good. And then you can do the same thing over on your other wrist. That can be helpful, or even needles, acupuncture can be helpful, but the pressure you can do yourself. And there's sometimes even bands that you can find in drugstores or online where they're actually trying to activate and turn on that pressure point with little wrist bands. I hope that that's helpful. So tip number 4, if you're getting to the level where you're thinking about taking medications to help relieve nausea, again, talk to your doctor. But in the drugstore, you can find vitamin B6 and an antihistamine called doxylamine, which is also sold as Unisom or a sleep aid. Combining vitamin B6 with Unisom actually creates this medication that used to be sold for nausea and vomiting in pregnancy, but it's been discontinued for one reason or another. And so sometimes OBGYNs or your obstetric provider, again, talk to them before you start taking it, will teach you how to combine those things, but it's usually vitamin B6, either 10 to 25 milligrams, 3 to 4 times a day. And then this specific antihistamine in combination can sometimes be really helpful for relieving nausea. Antihistamines can also make you pretty sleepy. That's a side effect. And again, of course, talk to your provider before you start taking anything. Other medications to consider are on the prescription level. They're all listed in that ACOG bulletin that I've linked here. Things like stronger antihistamines like phenergan can be helpful. Sometimes people will get steroids to help with nausea and vomiting. And then a lot of times people could ask for and want to use Zofran. Zofran is a very strong antiemetic. It's also called ondansetron. It's used often for cancer patients who are taking chemotherapy, and it really is a very strong and works well as an antiemetic. There's some side effects with it. Some people will get headaches, some people will get GI upset. Certainly, your doctor would like to try non-prescription interactions or interventions first, because some recent studies have shown a possible link with Zofran in the first trimester with some birth defects like cleft lip. Not all studies have shown that, but it's just your doctor might want to really try other things first. But if it's to the point where you can't keep anything down, even like liquids, Zofran really can help with the nausea. You just want to talk to your doctor about pros and cons. So in this video, we have talked all about nausea and vomiting in pregnancy. We've talked about how common it is, why we think it happens, some tips for preventing it, some risk factors, and then finally some tips for treating it if it does happen for you. I'm glad you stuck around because it is important to know when to call your doctor and really when to ask for help. So a little bit of nausea is kind of common, but as long as you're staying hydrated and able to keep some food down and you're feeling okay and managing at home, that is wonderful. But there are some times where people get to the point where they really can't keep any food down. They really can't keep any liquid down, starting to lose weight in that first trimester of pregnancy. Sometimes people don't gain weight in the first trimester, but losing weight and you're not able to keep food and liquid down, that is really a sign to absolutely see your doctor and maybe get some help. There are times where people have something called hyperemesis gravidarum, which is to the point where they're losing weight. They have laboratory changes, and sometimes people are actually admitted to the hospital. It's the most common reason people are admitted to the hospital in the first trimester. So it's very rare. It's less than 3% of pregnancies, but this is when you should really talk to your doctor, be seen, go to clinic, and sometimes even go to the emergency room if you really are struggling at home. There is help, and I want you to seek it and to take care of yourself and your pregnancy. I will tell you that the vast majority of the time, the baby is absolutely fine. So the baby is going to get all the nutrients it needs from the person who is pregnant. And we really need to take care of mom and make sure she is okay. But just having nausea and vomiting in pregnancy, it does not mean that there's going to be anything wrong with the baby. I really want to reassure you about that. I hope you learned something today. Be sure and like this video if you learned something, comment with any questions that you have, subscribe to this channel so you don't miss my weekly video all about reproductive health. I would love to connect with you. I've got a link here for my newsletter. Be sure and listen to the Baby Your Best Fertility podcast. I am just so happy to educate and reach out to you. And until next week, I'm wishing you love, luck, and pineapples.